Well, coronavirus is impacting cancer screenings. Medical experts are concerned over a surge in late-stage diagnosis.
Yeah, joining us today to talk more about this is Dr. Thomas Morrissey with the Baptist Health South Florida. And thank you, Dr. Morrissey, for joining us today. First, tell us about this new data about a decrease in the number of screenings.
Yeah, thanks. In terms of the decrease in screenings, we're seeing, the many effects of coronavirus on all aspects of our lives, that people are going for routine screenings and routine medical care less. And so there's been reports out of California which showed about 80% decrease in the incidence of pap smears and mammograms over the last year, at least the beginning part of the pandemic. And also in England, where they've shown that the decrease in screenings has probably led to people presenting with later stages of breast cancer and colon cancer where their prognosis isn't as good, and even predicting that there would be a 5 to 10% increased risk of death from cancer in those patients due to the delay from COVID. So again, it's very important, as hopefully things get back to normal, that people get caught up on the routine screenings that they may have missed when we're in the middle of the thick part of the pandemic.
So what other kind of barriers or challenges are you seeing from patients besides, maybe they are fearful of going to the doctor, but what other, obstacles or challenges do they face? What are you hearing on your end as to why?
Right. Yeah, so in terms of, there are barriers in terms of getting to the doctor and knowing where to go, and sometimes cost is an issue as well. And so to be able to figure out where you can get screening, how to get an appointment, how to get there. Some places probably were having decreased amounts of patients because they were trying to do some social distancing, and it was appropriate for a period of time to skip routine screening. But it's important to kind of get back into up to speed and to get up to date in the pap smears and mammograms before we start missing cancers or catching things where things are not as favorable as far as curing them.
All right, Dr. Morrissey, we want to make sure we get this in, but I understand that Baptist Health South Florida has teamed up with the Promise Fund in Florida to help make sure that everybody gets these screenings. Tell us a little bit more about that partnership.
Right. So the Promise Fund is a great partner for healthcare, both Baptist Health System and multiple area clinics in this area where we can get subsidized health screenings, pap smears, mammograms, and they also can help patients make appointments, help patients navigate through the system, which is sometimes a little bit daunting. And also, if there's problems with the screenings that need further evaluation, they have patient navigators who help kind of guide and coach the patients through making appointments for them and helping them get to the appointments and make sure that there's adequate follow-up so that, with the screenings, if we do catch a cancer early, that the treatment comes expeditiously and we can get a good outcome.
All right, well, talking to us today about delayed cancer screenings in our partnership with Promise Fund in Florida, based in Palm Beach County, Dr. Thomas Morrissey, thank you so much for joining us this afternoon.
Thanks very much.